Hello, my name is Ken Voll, and I'm the owner of Strategic Revenue Cycle Associates. I'm here today to discuss coding denial workflows. This brief presentation is to help introduce basic concepts and process associated with denials management, specifically related to coding errors. Coding denials occur when information from the clinical visit is placed on the claim form either incorrectly or does not align with the payor coding rules. During the session today, we'll take a deeper dive into these issues, and after you should be able to identify common coding-related denials that occur during the revenue cycle process, understand the claims adjustment reason codes and remittance advice reason codes associated with denial reasons and what they mean. Apply a denials review process to fix these errors and resubmit to the payor to minimize lost revenue. And also identify opportunities for avoiding basic denials by making small process changes. Let's take a minute to review a simplified version of the revenue cycle. It starts when the need for care arises, whether it be a consultation, an office visit, or the patient shows up at the emergency room in need of immediate care. Each of these visits requires data collected from the patient as much and as accurate as possible. Once the data has been collected and the patient has received clinical care, the documentation is converted into corresponding codes. Before billing the service, the claim should be reviewed for accuracy to ensure that it meets both payor requirements and all necessary coding guidelines. This process is referred to as scrubbing the claim and is normally done by the practice management system, or it can be done by human review. A claim is generated and prepared for submission to the payor, either electronically or via a paper format. After claims are submitted, the provider will receive a rejection, denial, or payment. These transactions are then posted to the account, and the account will either need to be resubmitted or sent on to the next payor, either the patient or a secondary, or closed out. The analytics phase is used to monitor specific data points and address the health of the overall cycle. We will focus on denials that occur as a result of the clinical visit. These denials are coding related and will require review. Let's talk a little bit about the denials review process. So once a claim has been denied by a payor, a clock begins ticking to fix it or potentially lose revenue by exceeding contractual time limits. Having a standardized workflow will assist in minimizing this risk. To start, make sure you understand as much as possible about the claim that was denied. Who is the provider and what is their specialty? Was it an inpatient or an outpatient visit? Who is the guarantor's insurance and what's the type of plan? This will be slow at first, but as you become more skilled, the claims review process will begin to assist you with fixing the claim quicker. Next, it's important to understand if the claim was completely denied or a line item was denied. This is an important question, especially with coded relating denials. A code may have been paid, but another code was bundled services. Were codes used in an unlikely combination? Either of these items may lead to partial denials that are easier to solve because you understand the claim detail. It's now time to look at the denial codes. At this point, we should have a grasp on what it will take to resolve the claim issue. If the denial reason is still not known, we must contact the payor for clarification. This can be done through the payor portal or directly contact via phone. So, there are common coding denial reasons, and the denials are communicated through the explanation of benefits, or EOBs, received from the payor. The payor utilizes standardizing coding sets referred to as claims adjustment reason codes, CARCs, or remittance advice reason codes, RARCs, for communicating their logic. These codes are used by payors to address the reasons why a claim was not paid or paid in full, and more importantly, help us to understand some of the details behind the denial. Codes are used individually or in combination with others to provide a detailed roadmap for better understanding. In this chart, codes have been categorized into common reasons. After reviewing the associated codes, these reasons represent the starting point for your search. And as we go through the denials review process, we may determine that there are other reasons why a claim was not paid and does not align with the listed categories, and you will need to adjust your grouping. There are additional codes used for coding denials, and they may represent multiple denial reasons. For standardized definitions of all codes, the website address is x12.org/codes, listed on the slide. So let's talk about how we actually fix some of these claims through our clinical denial resolution. Now that the steps for understanding what is wrong with the claim have been completed, the next step is actually locating the correct information to fix it. Here are some common reasons to look at while investigating the actual fixes. Medical necessity represents the codes listed do not support the need for service. To understand how to resolve the issue, we must understand what the payer-specific policies are that relate to those codes. Is the code payable? Can it be addressed by adding a modifier? Also, utilizing the National Correct Coding Initiative Edits Table, or NCCI, we can ensure that the code pairs are not combined with another service referred to as bundling. Patient status. Denials are common when a patient moves from one care continuum to the next. Making sure that the documentation reflects the place of service and associated codes are correct and represented on the claim form. Additionally, do the payer policies support the movement and are the orders present as well as any needed authorizations? Leveling. Leveling occurs when the payer states that the level of service provided does not meet the requirements of the payer and looks at the record to determine if there was a coding error or if there are potential ambiguities in the record causing the concern. A review of the record may determine that the information is correct and may need to be appealed to the payer with a detailed letter explaining the logic. Also, look at the abbreviations used. Payers will not go out of their way to understand what it is the provider means when they use abbreviations that are not standardized. Continuing on with our denials resolution procedure, procedures not covered by the payer relate to denials associated with incorrect procedure codes used on the claim form. Some of these issues will pertain to the authorizations on file, a review of what the provider was authorized to do. If it is incomplete or made more detailed than the original request, an appeal will need to be filed to amend the will need to be filed to amend the authorization of the code or their coding will need to be updated to address the original authorization. Please note that a change cannot be done just to match the authorization unless approval is received by the payer and or the provider. Diagnosis or invalid CPT codes are simply when the payer has stated that the code used is invalid in their system. It could be it is out of date or just simply a crosswalk to a different code in the system, as some payers simplify their process to pay for a service having multiple levels, but they are paying a flat rate. Check the system to make sure current payer fee schedules are loaded and all updates have been made. Last are denials for services not covered by the payer. It usually has to do with the payer rules. Make sure you understand the rules regarding the service on the claim form by reviewing the payer guidelines, including any potential code-specific policy associated with the services billed to the plan. Other issues may be that some services will not be covered as they are considered specialty codes that are not approved for the provider. For example, a routine dental exam completed by a primary care provider. So let's take a second to talk about some mitigation strategies. So taking the denial data and categorizing the issues is helpful for two different reasons. The first is the opportunity to fix the claim and avoid potential lost revenue. And the second is the opportunity to address a process where multiple denials occur. Some of the common areas to be reviewed are the charge description master, making sure that all codes are up to date and contain beginning and end dates. Address all edits, especially ones where a payer has changed their policy for the next calendar year. Review the authorization process and make sure it accounts for handling of paper authorizations and the review policy. Check payer websites to determine if the requirements have not changed for the service provided. The last and most important step is to make sure that you have an established audit structure in place, especially as changes occur around new codes and updated definitions. Also, look at implementing a focused clinical documentation improvement process to address common coding denials. Careers associated with coding denials include being a coding or CDI specialist. A charge master analyst is responsible for maintaining the code sets contained within the charge master, making sure they are up to date and comply with all provider rules. With these roles, you will be responsible for making sure denials are kept to a minimum and all policies are up to date. Data analytics plays an important role related to denials, as discussed previously, and utilizing coding knowledge will assist the organization in tracking denials and creating reports necessary to minimizing the risk associated with them. So to review, denials represent the claims a payer has deemed unpayable based on established established guidelines and rules. Coding denials specifically represent items associated with the clinical visit as stated on the claim form. Coding denial reasons are most likely associated with the selection process or how the electronic medical record places these items on the claim form. Utilizing an established denials review process will assist with quickly identifying the reason on how to best address the item. Creating denial reasons will allow you to group common CARCs and ARACs to work similar denials together. Utilizing this logic allows you to pinpoint common process errors within the revenue cycle to create mitigation strategies specifically on those systems where the information is stored. Want to learn more? OHIMA has developed a revenue cycle hub for you to easily access informational videos, including today's video, as well as articles, careers, certifications, and education related to the revenue cycle. If you are interested in exploring a career in the revenue cycle or simply would like to learn more, please scan the QR code on the screen or visit ohima.org/revenue-cycle. All of OHIMA's information videos will be available under the Resources tab. Thank you for joining me today, and I hope you found the presentation helpful. I have included my email if you have any further questions or comments.